private college out there. I double majored in pre-medicine and biology and minor in music. From there, I went on to Palmer College of Chiropractic and actually completed a 5-year program in 3.5. Graduated at the top of my class. I then went to Denver, Colorado as an intern and worked out there for about 6 months and graduated, or not graduated, but worked out there, and they had 1,600 patient visits per week, so I learned a lot out there. And then ended up doing another internship here in Nebraska. On the day I was about to leave, the doctor said, "Would you like to stay and purchase the clinic?" And so I agreed, and long story short, I've been here for 4 years. Okay? I met my fiance. You guys actually met her already. We're getting married in June of this year. And we do these talks just to educate the community, right? We want to make sure that you guys are as healthy as you guys can be. There's a lot of information out there, you know, with the World Wide Web. But a lot of people are over-informed and undereducated, which is a very true statement, okay? So there's a lot of information out there, and a lot of people don't know what the truth is. So what we want to do is just educate you guys on what true health is. We're going to be speaking on ergonomics. Does anyone know what ergonomics is? If you guys were to give me a definition of ergonomics, what is that? Okay, so there's a lot of, unless you guys are really shy. Okay. What ergonomics really is it's really an applied science. And it looks at human characteristics and it says, well, how can we make these human characteristics work the best with things, like devices, right? And how can we do those so it's the most effective and the safest, right? So that's what applied science is, or ergonomics is. There was something that was actually created. I want to show a video. I don't know if it's going to work, but there was something that was created, they think, in the 9th century AD by the Persian, and I'm going to say by Persian males because that's important, and it's still around today, okay? But it has now become very unergonomic, okay? And what it is, I'm going to show a picture of it. And so, looking around here, a lot of people, I think, I'm looking at all your shoes right now, are heels, right? And so what this video, if it actually works, is going to show you is the damaging effects of high heels. I've shown this video in our office several times, and people literally do not wear heels in our office anymore, okay? So I want to show this 4-minute video. Hopefully it works. Probably. Okay, let me just tell you. Let me just tell you about it, okay? So when you actually wear a high heel, just 1 inch, it actually propels your body forward about 10 degrees. Now what that does is it actually causes wear and tear on your knees. So they know this because what happens is women actually suffer from osteoarthritis in the knees more than men. Okay? Have you guys ever heard of bunions? Have you guys ever heard of hammer toes? Have you guys ever heard of neuromas? Okay, all the result of high heels. So these are very damaging to the body, but in the 9th century AD, what they actually served as a purpose was to actually keep feet in stirrups on horses, which makes sense, right? That's why you get cowboy boots and they actually have heels on them. So the thing is these are very damaging to your body and actually cause a lot of wear and tear on them, okay? Now, what causes osteoarthritis? You guys know what arthritis is? You guys have heard of that? Okay, a lot of people say what? It's part of what? Old age. Well, osteoarthritis is not part of old age. If you think about a tire real quick, if you misalign a tire, what happens to that one misaligned tire? What happens to it? It wears out. If you misalign a joint, guess what happens to the joint? It wears out, okay? So when it comes down to this, is why is this so important is because when it comes to work injury in the workforce, it happens a lot more than it should. So about 3 million cases in 2011, injuries at work. Now, out of those, 18% of those included muscle issues, tendon issues, joint issues, and ligament issues. Now, the most common ones that actually happen are TMJ problems, right? So why would that happen? You guys ever get jaw pain? Maybe you guys get stressed out. What do you guys do? Okay, punch down, right? Another thing is headaches is a very common issue that happens, okay? So these are called stress headaches, right? They get tension at the very top, presses the nerves up there, and causes issues. The other thing that will happen are disc issues in the neck, bulges and herniations, and also in the lower back. The last one is what? What's this called? Carpal tunnel. Those are the most common ones that actually happen, the top 4. Now, the reason why these happen are not because of, lifting. Those can happen, but it's not the most common reasons why they happen. It's really the result of repetitive actions. When I say repetitive actions, I always think of a body in movement, right? But this isn't the case. So sitting, could that be considered a repetitive action? If I sit for 8 hours a day, obviously, how many of you guys sit a long period of time? Okay, a lot of hands just went up, okay? How about standing in one position all day long? Some jobs require that. Right? That would be a repetitive action. Typing all day long, repetitive action. How about slouching? Is that a repetitive action? Absolutely, okay? It's funny, I just looked at you guys, and you guys all kind of sat up over shit, okay? So when it comes down to that is work injuries are a very real deal. They happen a lot, 3 million times a year in 2011. And so what we're going to do, we're going to talk about the goal of today. Really what I want to teach you guys is really ergonomics and how that affects the position of the spine and what that's going to have as a direct effect on the nervous system. Okay, so that's our goal today. All right, we're going to do some basic anatomy real quick. So I'm going to steal, I hate to do this, Christy, will you come up here? All right, so we're going to do some basic anatomy real quick. Okay, so I want you to not face them. Okay, so what's the master control center of the entire body? Where's that set? Point. Up here. Okay, so what's up here? The brain, right? And then coming from the brain is the what? Not spine, but what? Spinal cord, and off the spinal cord are the nerves, right? So have you guys ever heard of the central nervous system? What does that include? Central nervous system. It includes the things that are central, so the brain and the spinal cord. Everything that comes off the spinal cord are called the nerves, right? The nerves are part of your peripheral nervous system. So, go ahead. You're good. Okay? If I had a stroke, or someone had a stroke, would that be a bad thing? Okay, what would that cause? Maybe some facial paralysis, maybe some limb weakness, slurred speech, dilated pupils, right? If I broke my neck, Christopher Reeves broke the top bone in his neck, what happened to that guy? Shut down everything. Okay, what did they do? They put in a respirator so he could still breathe. They put in a pacemaker so his heart would still beat. They would massage his colon so he could still go to the bathroom. Okay, what would happen if I cut the nerve that went to your heart? What would happen to you? Would you be alive or dead? Okay? If I pinched the nerve that went to your heart, would it work better or worse? Okay, and that could turn into a symptom. Absolutely, right? Now, what I want to do is I want to show this to you. And how many of you guys have kids? And how many of those kids, keep your hands up, have video game systems? Okay. If you want to figure out how important something is, you can figure out how long you can live without it, it'll tell you, right? So your kids might disagree with this, but if I said, how long could you live without video games? And the answer would be forever. You could live without them forever. If I took away food from you, how long could you live without food? A month, right? If I took away water from you, you could live a couple days. If I took away air from you, about 2 minutes, 3 minutes. If I cut the nerve that went somewhere in your body, you wouldn't live a single second, right? That's how effective this is. Okay, so good understanding real quick. And I want to say this. We will be doing a quiz at the end. I'm going to give away something, okay? So the more you guys can remember now, the better, okay? So real quick review. 3 things that make up the nervous system are the what? The brain and the nerves, okay? What 2 things make up the central nervous system? Brain and, okay? What makes up the peripheral nervous system? Nerves. Perfect, okay? Now we're going to talk about the spine real quick. So there's general anatomy that we're going to talk about when it comes to the spine. Actually, I'll use this one. All right, so what are these called? These are called vertebrae, right? You actually have 24 of these. There's 26 bones that actually make up the spine. It's the 24 vertebrae, 1 sacrum, and 1 coccyx tailbone, right? In between the bones are the what? What's the yellow things? These things. Disc, perfect, okay? Now, when it comes down to this, you actually have several structures on these bones. The front portion, or the front half of the bone, is actually called the body. Okay? The body supports all the weight. So all the weight from top down goes through the body. The back portion is all the joints. Okay? If you guys actually felt your back right now, go ahead and do this. Seriously. Okay? You guys feel bumps. Okay? What you guys are actually touching are the spine's process. Okay? These things that are coming off the side are actually called the transverse process. Okay? The way I remember that is if I flip it this way, okay? See how this looks like a T? You guys see how that looks like a T? Transverse process. These guys that are coming off of there. What's this back one called? Spinous process. What's these called? Transverse process. You guys see this yellow thing in the center there? Okay, that's called the what? What do you think that is? You guys got it. I heard someone say it. Spinal cord. Okay? Where are these things coming off the spinal cord? Nerves, and those are part of the what type of nervous system? The peripheral nervous system. Okay? When you guys look at this, the other structure you guys are going to see right in between, very center in here, is called the lamina. So if you guys ever heard of someone having spinal canal stenosis, which is narrowing of the spinal canal, they'll do a laminectomy. What they're essentially doing is they're cutting both sides of that and they pull away all that portion of the bone. Now what does that mean? Is that good or bad? If someone pushed on your back after you had a laminectomy, what could they potentially touch? The spinal cord, okay? So you look at these, those are the basic structures of the bones, okay? When you look at this, there are 6 different joints on every single bone, okay? Why is that important? When it comes down to your shoulder, is this a big joint? Shoulder is a pretty big joint. Have you guys ever heard of a luxation? Someone can luxate a shoulder. What do you think that means? Someone just luxated their shoulder. They just separate, dislocate. Okay, so luxation is just the medical word for dislocation. Okay, if I said the word subluxation, the prefix sub, what do you think that means? Sub means what? Small, right, or minor, right? So it's a partial dislocation. So when it comes down to bones of the spine, there's 6 different joints keeping it all in place. So you can't. It would be a horrendous accident if you ever did it, but you could potentially luxate the spine, which would be really bad. Okay. But most people do what to it? They subluxate it. Remember that word, subluxate it. Okay? Next thing I want to talk about, let's zoom. Okay. Okay, I want to look at this up here. So when you guys talk about the spine from the front view, what should it be? Okay, so what's it called if someone came in to our office like this? What would that be called? Starts with an S. Scoliosis, okay? Would this be good or bad for their health? Okay? On average, a 20-degree scoliosis will take 10 years off someone's life. Did you guys know that? 20 degree. Okay? So from the front view and back view, you should always be straight. From the side, I want you guys to remember this. How many curves do you think there are supposed to be in the spine from the side? Okay? I hear 3. Anyone else have another guess? Any other guess? So there's actually 4. Okay? There's 1 in your neck, 1 in your upper back, 1 in your lower back, and don't forget this guy right down here, the sacrum and coccyx. That makes your 4th one. If you deviate away from that, that is what you would call a subluxation. So if you misalign the spine, you're talking about a subluxation. What does subluxation mean again? Subluxation means what? Partial dislocation, right? So when you look at this one up here on the left side, that is a normal curvature of the neck. It's an x-ray. If you look at the one right to the right of it, it's abnormal. What's happening to that neck? So they're looking in this direction. What's happening? It's going where? It's going forward, okay? And they've also lost that curvature in there, okay? So why is that such a big deal? That's what we're going to talk about, okay? And this is all building up to why ergonomics is important. So when you actually subluxate a spine, you're actually going to do some damage to some things in here, okay? First thing you're going to actually put damage on is what? These things coming off of here, which are the what? The nerves, and then also where you're going to do damage to is the spinal cord. So when your head goes forward like this, that's a bad thing. What did we talk about when it came down to misalignments in a tire? What happens to the bones and the cartilage? They're going to wear out. So is arthritis part of the normal aging process, like a lot of people think? Okay, so if there's a misalignment here, what's going to happen? It's going to wear out. So that's what this is showing here. Normal alignment, they are actually going to maintain normal disc, normal cartilage, normal bones. As it goes through this process, they're going to go phase 1, phase 2, phase 3. Essentially what happens in phase 1, you lose the alignment, which they have. Phase 2, you're going to start seeing the wear and tear in here. And phase 3, it's going to start clumping all together, which is really bad. If I look at these things from the side, we actually have a normal disc in here. If you look at the side of this thing and I raise up that nerve, you're going to see a big open hole in there. I'm going to pass this around. I want you guys to look at it. Okay, that's healthy. If you lose the disc, what happens to the hole where the nerve comes out? It gets pinched, right? So if you look at this model right here, you're going to notice a big difference in there. So I'm going to start these here. I want you to just pass them all the way through. All right, quick review one more time. How many joints are an individual bone, vertebrae?
24.
Okay, so there's 24 vertebrae in the spine. There's 26 bones in the spine, right? 1 being the sacrum, 1 being the coccyx, and 24 vertebrae, okay? There are 6 joints on every single bone, so it's very hard to luxate the spine. What does luxation mean? Dislocation. A subluxation just means what? Partial dislocation, okay? Why do people get arthritis again? Is that normal? Okay, why do people get arthritis? So there's a misalignment that causes wear and tear, okay? All right, let's look at this. So I got the spine here. Now I'm just going to say this real quick because it's not just work that you guys are hurting yourself. It's probably at home too, right? Because average American, they sleep on a mattress that's actually too soft, right? So if you're a back sleeper, which you should be, this is what you look like, right? And if you say, you know what, I'm a side sleeper, you know what, okay, you look like this, okay? Now what do? Morning routine, what do? We get up in the morning, okay? And we walk down the hallway and we say hi to everybody, right? Hey, how are you doing? And then we sit down at the table and what do? We eat a little bit, right? We're eating. Is this a good alignment right now? No? And so then what do? We get up and we go to the bathroom, we get ready for the day and we brush our teeth, right? And then what do? We drive to work, okay? And we're sitting in this position. And what did you guys say already? You guys said, oh, I sit all day long, right? You guys think you guys sit up in pristine posture all day long? Or how do you guys think you guys sit? Like this. And then you drive back home like this. You sit down, you eat a little bit more, right? And then it's too early to go to bed. You know what happens then? So we sit down in our favorite recliner, and we sit like this, we watch a little bit of television, and do it all over again, right? And so that's the typical day for your spine. But here's why this is so bad. We're going to connect all the dots together, okay? We know this isn't the right alignment for one reason, okay? Is because we said there's 4 curvatures in the spine. How many curvatures really do I have right now? How many? I got 1, okay? So I've lost the curvature in my neck. I've accentuated the curvature in my thoracic spine. I've lost the curvature in my lower back, and I maintain that one in the lower back, okay? But that's all fused. You can't really change that. When you lose the curvature in your neck, here's what we know science tells us. When your head goes forward, it's going to stretch your spinal cord, and it's going to put 40 pounds of tension on the spinal cord. So if I could somehow take your spinal cord out of you, and I put a 40-pound weight at the bottom of it, can you imagine what would happen to that thing? The spinal cord's soft, right? So it's going to stretch it out. We know that when your head goes 1 inch forward, you're going to put 10 pounds of tension on the spinal cord. And we know when you do that, I want you guys to do this real quick. If this represents like the curvature in my neck. So I want you guys to do this, okay? Take your hand, put a curvature in it, and just feel the skin in there. Is it tight or loose? Now, do this, straighten it up, okay? Now feel the skin in there. What happened? It got really tight, right? So here's what we know. When you lose the curvature in your neck, it actually stretches out the spinal cord, right? So another way of visualizing that is, I'm going to pick on someone. You're looking at me. So you have a rubber hose, okay? And I'm looking at you, and it's like a rubber band. The diameter of the thing is this, okay? But I take a huge step backwards. What happens to the diameter? It gets smaller because I did what? Stretch it out, okay? So we know when your head goes forward like this, we're actually stretching out the spinal cord because we've lost the curvature. Now here's the kicker with that one. When you actually stretch out the spinal cord, if you think about a wire, there's a plastic covering around the thing, right? There's the metal piece inside, right? And then there's a covering around it. Well, your nerves actually have that covering. It's called myelin. When you lose the curvature and you stretch it out, you actually demyelinate the spinal cord, which is really bad. That's what you would call symptoms like MS, multiple sclerosis, okay? How do you know if that's going on in your body? Well, there's a quick test, right? If you tip your head down, you hold it here, and someone puts a little force on it, okay, and it causes an electrical sensation, you probably have that going on. It's been there for a long time. Your spinal cord is actually demyelinating. The last thing up here, I know it's hard to read, but the last thing that's saying up here is, here's how important this is. If I took a bone in the spine and I moved it a little bit, what's that called again? Subluxation. I moved the bone, partial dislocation. If I took that top bone up there and I misaligned it, okay? What this study shows, and it's from Chicago, so I love it already, okay? But here's the deal, is they set up a mock adjustment. An adjustment is just designed to put the bone back in place, okay? So they set up a placebo adjustment. And then they did the real deal on people that had high blood pressure. One adjustment lowered blood pressure by 17 points on average. That's more than 2 blood pressure medications ever given in combination, and there's no side effects to it. So they just put the bone back in place, which took the pressure off the spinal cord, and the body worked again. Does that make sense? Okay? All right. Moving on to this. What are some of the causes of spinal problems? What are some causes behind this? Okay? Well, one, birth, right? there's a new condition that's kind of shown its face in the last 20 years, right? And kids are coming out and all of a sudden they're left blocked like this. Maybe you guys seen a kid like this, or maybe you know someone. What's this called? You guys know? Let's see. Torticollis. Torticollis, right? So they get locked in this position. The reason why that's happening is because we're doing, there's a thing called natural birth, no intervention, right? And then what's some types of intervention we can use? Forceps, you guys heard of those? Vacuum extraction, right? And then the last one we can use like a C-section, okay? Now, think about the worst case scenario, C-section. A lot of people don't really consider this that bad, but you gotta understand it this way. When a baby is born, what do you do to that baby? You support the head. Why? Why would you do that? Because what's not developed yet? The muscles, right? So the only thing that's keeping the spine in alignment, believe it or not, is actually something called ligaments. You guys have heard of those, right? So if I sprain my ankle, I just wreck the ligaments, right? Now just imagine this. What do they grab onto when they do a C-section? Arm, legs, or head? Head, okay? Can you imagine if I picked up a kid by their head? Not only am I trying to get that baby out, right? So there's a lot of force going through there. There's videos of mom's back coming off the operating table with how much force is in there. Now all of a sudden they damage all this stuff in here, there's pressure on the nerves, and now they get locked in this position. Okay? So birth trauma is the first one. Learning how to walk. Have you ever seen a kid focus on nutrition, exercise, and detoxification? We're going to just surge real quick. What I want you guys to do is clap. We're going to just clap for 20 seconds. We're going to rest for 20 seconds. We're going to do it again, rest, do it again, rest. So it's going to take about a minute. Okay? So I want you to go ahead and start. Go ahead and clap as fast as you can. Keep going. All right, keep going. Just go faster. This does, is, you guys know jiggly arms? Okay? This actually tightens all that up. Okay? So you're going to rest for 20 seconds. We're going to do it again. Okay? We're going to get your heart rate up. And studies show you guys will remember more because your heart rate's pumping higher. Okay? Ready? Set? Go! Rest again. Keep going. So your arms are getting higher. You got to be slower down. Rest for 20 seconds. We'll do it one more time. Go sit down. You guys know you guys get happier when you guys exercise? Did you guys know that? The pressure goes down. All right. Ready? Set. Go. So maybe now you guys are like, oh, arms. Keep going. Good job. Go ahead and have a seat. All right. I want to show this video, and this is actually kids learning how to walk and doing some crazy things. how people can get hurt, right? Subluxated. All right, you guys all have a nerve chart, right? And so when you guys look at this thing on here, what this is just showing you where every nerve goes, what it controls, and then possible symptoms you could have when you actually compress that nerve. All right, so let's talk about improper sitting posture. Pretty simple. We already talked about it a little bit. So if you look like this, when you sit, which a lot of you probably do, right, this is bad. So here's how I'm going to break it down. If your eyes angle downwards, that's bad. So if you guys saw the study that came out, it was on Good Morning America probably a month and a half ago. They were talking about something that causes everyone's head to go down. What is it? iPad, texting, all this other stuff. Now we actually have, this is a new thing, so I've only been open for 4 years, okay? A weird thing started happening about 2 years ago. I've never ever seen it before. They never ever talked about it in school. All of a sudden, I'm seeing 17-year-olds come into our office with arthritis. Bizarre, okay? The reason why that's happening is because where's the curvature supposed to be? What direction? This way, right? And all of a sudden, if you look down like this, what happens to the curvature? That's a artificial subluxation. So what's happening to the bones and the disc in there? They are breaking down. So all these kids are having arthritis. Bizarre. So if you guys catch yourself looking down, it's not a matter of, oh, it hurts or I feel pain. You can be doing damage to your spine and not even know it. So if your eyes are angled downwards, that's one. If your head is at 60 degrees, there's 60 pounds of pressure on the spinal cord. 60 degrees, 60 pounds, okay? If your head is forward, which is called forward head posture, okay? How do I know that? Is if this circle right here is the shoulders, that is supposed to be in perfect alignment. So this is your head up here, this is your shoulders. You see how this is forward to where your head is supposed to be at, okay? That's the first one. When your head goes forward like this for a long period of time, what will happen is your thoracic spine will actually start to develop more curvature. This is what you call a Dowager's hump. Right? So you can actually look at other people and you'll actually see, oh man, they have a Dowager's hump. Next thing, when you actually sit for long periods of time, your head is going forward, you get this increased thoracic spine. What happens to your lower back? It actually starts to curve the opposite way and your pelvis rocks backward. So eventually you look like a big C. Okay? All right. That's improper sitting posture. Here's how you guys are going to set a desk chair. For most of you guys have chairs that go up and down, or are they chairs like these? They go up and down, they have a back on them that may rock. Okay, so here's what I want to do. I want to volunteer. Anyone want to volunteer real quick? Anyone? I'm going to pick on you again. You guys stop looking at me. All right, so I want you to sit in here, and actually I want you to sit facing this direction. I want you to try to get in the best posture you can. What you think normal is. Like if we're ergonomic talking, I want to see where she's at, okay? So you think you're good? All right, how do you guys think she looks? She looks pretty good, wrong. Okay, this is actually really bad for the spine right now, okay? Everyone thinks that you're supposed to be at 90 and 90. What that means is you look at her knees, and this looks like a 90-degree angle, correct? Okay, and you think you're supposed to be at 90 here, right? So this is what we're looking at right now, right? Is that fair? That's what we're looking at? That's really bad. Okay, go ahead and have a seat. So we're going to talk about, if you guys have those adjustable chairs, actually how to set them up the right way. Now, the first thing I want you guys to know is when it comes to your legs, they actually should be angled slightly downwards, so you can play around with the height. If you get it too high, it's going to put pressure on the back of the knee. If you get it too low, it puts pressure on the front of the knee. So I want to find the happy medium. So your thighs should be actually angled slightly downwards at all times. Okay? Should you ever tuck your legs underneath of you, like underneath the chair? A lot of people do that, right? So what we're talking about there is if you're one of these that sits like this, right? This is really bad on your knees, right? The other thing too is, does a lumbar support ever support me if my back doesn't touch the back of the chair, right? So, oh man, I got this $600 chair, let me tell you about it, okay? Man, it's so awesome, and you see the person sitting in it, and they never ever touch the back. So is that even working, right? The other thing you want to make sure is you never ever sit straight up. You actually should be slightly angled backwards, 100 degrees to 110 degrees, okay? And so let me give you an example of what this should look like. The cushions actually should be very firm. The firmer the mattress, the better. The firmer the chair, the better. All right, so this is an example of really bad. Would you guys say that's how she kind of sat, right? So that's really bad. The other thing too is keyboards. Where are the keyboards? You guys have a tray? You have them on top of your desk? Are your arms angled like this, or are they down? Right? So I'm going to show you what normal should look like. All right, let's look at these angles in here. Are they sitting straight up and down, according to that picture? right? So what are they doing? They're slightly angled backwards, right? So you guys can actually set on your chair. There's a tension knob typically underneath the seat, okay? And you actually can angle or affect the tension on the chair, and then even some of them lock them right into place. You guys know what I'm talking about? Okay? The next thing is setting the height. What should your thighs be doing? They should be going down. Where should your feet be? Should they be back underneath of you? No, they should be slightly in front of you. Ideally, what you should be looking for, okay? They actually have, it should be on a tray, if not anything, right? So it should be on a tray, but the one thing I will say is they actually have these arms, swivel arms. You guys know what I'm talking about? That you can actually position the actual keyboard so your arms are always down. Your top of your monitor should always be where your eyes are at. So this makes an interesting challenge for what? If you don't have a desktop computer, you have a what? Laptop. Where are your eyes always? So what's happening to the curvature in your neck? And what's happening to the bones and the cartilage in there? It's wearing out, right? All right, so that's the ideal work position. You guys got it? Say it back to me real quick, because this might be a quiz question, okay? You should be angled backwards. How many degrees? Perfect, okay? Should your thighs be angled up or down? And should your feet ever be behind you?
No.
Okay. Should your back always touch the back of the chair? Absolutely. Okay. Where should your eyes be according to the monitor? Okay. Let's say your monitor's down. What would you do? There. Perfect. Good job. Book like a phone book or something underneath of it. All right. The mouse. The mouse. I want you guys to do this real quick. So I want you to put your hand flat on the table. And I want you to try to left click. Left click. Keep your hand flat. Is that pretty difficult? Okay. Right click. Some of you guys are saying no. This maybe it's me, but this seems a lot less efficient than. Okay. Ergonomically, when they design mouses, right, they didn't design them flat. What they do, they put a curvature to the top, so your hand would rest on top of it in a semi-relaxed position. The thing that they didn't consider when they designed the mouse is what's your wrist doing. So is it natural to have your wrist like this? You know what this causes? Carpal tunnel, right? That will cause carpal tunnel. Any idea what carpal tunnel is? What is that? It's a compression of a nerve, and nerves are part of what part of the nervous system? Peripheral nervous system, right? And so what's happening in here is when you do this, you're closing up the tunnel. So there's a tunnel, like a hole, and you're doing this to it, closing it up, okay? So how would you fix that? Well, one, you'd keep your hand supported. So these mouse pads, believe it or not, you got to think of it this way. Even though you're not experiencing carpal tunnel now, for a lot of you, okay, this will prevent it from ever happening. Have you guys ever heard of anyone having carpal tunnel surgery? Right? So they go in here and literally what they do is they cut the tendon, or not tendon, but the ligament that goes across there to open it back up. Maybe that grosses you out, I don't know, okay? But the thing is you should look for a mouse wrist support and also for the keyboard. Okay, let's look at this up here. I want you guys to understand something real quick. When it comes to warning signs, a lot of people have these things. And there's a lot of things you guys can actually prevent when it comes down to the spine. And so I'm going to ask you this real quick. Is this person doing good right now? Okay. I want everyone to look to your left real quick. Everyone look to your left at the person next to you. Okay. I want you to figure out real quick, does their head look like it's going forward? Does it look like their head is here? Does my head look like it's doing this? This is what it would look like. Does that look normal? Okay. So the thing is if their head is going forward, what does that mean about the thoracic spine? What's going to happen there? Okay, so if the head is going forward, what happens to this mid-back? Okay, it accentuates that curvature. When that happens, what happens to the lower back? You lose the curvature down there. Okay. Remember when I gave the analogy of using your hand? What happens to the skin if you put a curvature in there? Okay, it's loose. If I straighten it out, what happens to it? What would happen if I bent my fingers backwards? Okay, what would happen to that? Where's your spinal cord run? Is it just in your neck or where's it at? It goes all the way down here. Okay, so if I lose the curvature in my lower back and lose it in my neck, what's happening in my spinal cord now? Okay, how do you know if that's happening to you? Okay, you look at something like this. Okay, are headaches common? Headaches common? Are they normal? Okay, so I'm seeing a no and I'm seeing a yes. Okay, show of hands. Are headaches common? Show of hands, okay, yeah. So a lot of people are saying yeah to headaches, okay? Are they normal? Okay, they're not normal, but they're common, okay? Menstrual problems, high blood pressure, depression, insomnia, sciatica, neck pain, dizziness, fatigue, acid reflux, numbness, tingling, asthma. Now what you guys see up here is a letter and a number next to it, right? You guys see that? So if you guys look at this nerve chart, I want you guys to get that out, okay? On there you guys see C1. What C1 is referring to is the actual nerve. That's the name of the nerve that comes out of there. If you look to the column right next to it, it tells you exactly where that nerve goes and what it does. If you look at the column next to that, you're going to see the most common symptoms of that. So you guys see C1, where it goes, and then you see the symptom that says headaches, right? High blood pressure. You guys see that one on there? C1. A possible symptom of that is high blood pressure. That's the bone they adjusted in that study, and they found out lowered at 17 points, okay? You look at this sciatica, L4, that's on the back of the sheet. Okay, so here's the deal. Let's say you have a symptom going on right now. You guys filled out those symptom things. You could find your symptom on here and figure out which nerve could be involved in that, okay? What do most people do when it comes down to symptoms? What do they do? When it comes to a symptom, if I had a symptom like a headache, what do most people do? Take a Tylenol, Advil, ibuprofen, okay? There's only one problem with that, okay? Nurses are great at answering this question because they'll always say this. Well, I had a patient that came in and they're complaining of this. And now I'm seeing them, I was only seeing them maybe once a month, now I'm seeing them once a week. Okay, so when you take a medication to cover up a symptom, what happens to the problem usually? Does it get better or worse? Okay, here's case in point. If I had high blood pressure and I took a blood pressure medication, I came off of it, does my blood pressure come back? Does it go back up? Absolutely it goes back up, okay? So the thing is what I want people to understand is you can actually fix problems without just covering up the symptoms. So my brother actually had cancer when he was 17 years old. My sister was diagnosed with cancer when she was 21 years old. The thing is my family never asked, well, why do you think this happened? Why do you think my siblings both got cancer and stuff like that? They never asked the tough questions when it came down to this. So if you have any of those symptoms going on, you need to say, well, why do I have it? And how do we fix it? Okay? So warning signs need to be honored. Now, this next one, here's what we're doing in America real quick. We take more drugs than any other country in the world. Okay? We represent 5% of the population. We take over 80% of the meds. All the drugs that are created in the world, we take 80% of them. Okay? The other thing up here is there's a big problem that's actually happening with painkillers right now. I don't know if this is affecting your guys' communities, okay? But there's 30,000 deaths that happened last year alone due to painkillers. Now, it's not adults, okay? Mom and dad will have it in their pain medicine cabinet, and guess who gets a hold of it? The kids get a hold of it, okay? And they start taking the medications. Now, these type of painkillers, they're interesting because what happens is your body gets used to it. So therefore, to get the same effect, what do you got to do? You got to up it. And so then they're not following the recommendations of it, right? Because they want the pain relief, and then it ends up shutting them down, okay? The other thing, too, this is a shocking number. This is a true number, too. Citizens in Canada, Christy's actually Canadian, so threw this one in there, but 74% or 74 prescriptions drugs are given if you're 80 years or older, on average. 74. 74 drugs, okay? Nearly half of Americans die of heart disease and cancer, okay? Have you guys ever known anyone that's died of heart disease or had a heart attack? Yes. How about cancer? Yes. Okay, so a lot of people are dying of those things. They said 5 out of 6 Americans are going to die of one of those two things. Okay? How are we doing when it comes to Alzheimer's right now? Okay, Alzheimer's is going up drastically, 5 million new cases, 25,000 people killed in hospital error in Canada, 200,000 in America every single year in hospital error. Okay? Looking at some of these numbers, they should scare you. So the thing I'm trying to point out to you guys, there's a right way and a wrong way of taking care of things. This right here is preventable. You guys could change your workstation and fix this thing, right? You guys could use a better mouse, right? You guys could change your chair and be better, okay? If you guys answer, who's on the phone all the time? Anyone on the phone? Answering the phone, okay? What would happen if I answered the phone with my right hand every single time? What do you think would happen? Do you think that would cause some problems? So what's the easy solution to that? 1 month I put it on the right side, next month I move it over to the left side and start answering my left side. Does that make sense? So it keeps your body in balance, okay? So here's the thing. I want you guys to honor your symptoms. And what that really means is if I were to accidentally swallow bleach by accident, okay, what would I want my body to do? Get rid of it, throw it up. How many of you guys like to throw up? Probably not very many, okay? But is it helping my body, right? If I got a bug inside of me like bacteria or virus, what would I want my body to do? Okay, get rid of it, right? So the thing is there's check engine lights coming on in my body to say that, hey, there's a problem here, and I want my body to take care of it. If I had sniffles and runs and sneezing and stuff like that, what do most people do for that? Over-the-counter medication, right? So mucus is actually encapsulating the bug or allergy or pollen, and what's it trying to do? Get rid of it. And I'm trying to override that mechanism. You see what I'm saying? So when it comes down to these things, is I would highly encourage you guys to honor your symptoms and understand that symptoms are coming on in your body to let you know there's a problem, okay? Headaches are not normal, okay? What I'm going to do, anytime we do a talk, is we always open this up. So did you guys learn a lot? Like you guys learned about workstation, you guys learned about the mouse, you guys learned about the chair, okay? You guys learned about how you guys should be. How many curves should you guys have again? Okay. One other thing that just popped in my head, one of the things that can cause issues, real quick, is bifocals, right? So what do people do with bifocals? What do they do? They look up and try to look down through the outer lens. So what does that do to the neck? That causes issues, and it's going to cause the head to go forward. So one of the things we always do when we do these talks is we always open it up for you guys, okay? I want to show this up here. I want to show you guys this quick little video. Is this a good curvature in the neck? Does that look pretty good? Yeah? So which way are they facing? Ooh, there we go, this way. So here's the jaw, right? Here's the back of the head, and then the teeth are up there. I want to show this video. So this person was in a 5-mile-per-hour car accident. So tell me what's going on here. They took an x-ray every 6 months, and they compiled it together and made a video. So what's happening first? Okay, is that good or bad? Now, if you misalign a spine, this is phase 1, right? Subluxation, right? What's going to happen next? Misalignment leads to cartilage, bone spurs, arthritis. Okay, so now you're going to see this. Look at the spaces in between the bones. You guys see those? Those are the discs. They look pretty good. And the front of the bone should be really flat. So let's keep going. Okay, what's happening here? It's reversed. So this is a reverse curvature, which is really bad. How much tension is on that spinal cord now? At least 40 pounds, right? What's happening to the covering around the spinal cord? It's called myelin. What's happening to it? Demyelinating. Perfect. Good job. Okay, keep watching. Now you're going to see the cartilage breaking down. So you're going to see it looks like the spine is actually getting shorter. You guys see that happening? Look in here. Look in here. Watch the front of the bones. You're going to start seeing points coming off them. Those are called bone spurs. How's that spine look right now? That looks really bad. Okay, let's keep fast forwarding. Okay, so that's where it ends. Okay, this is bone on bone, arthritis. The only thing they're going to do for that is surgery. Okay, is that preventable? Is that preventable? Absolutely. Okay, all right. When we look at this, Blue Cross Blue Shield did this study, and they said, okay, what they want to know is, well, if we're going to pay for chiropractic services, we want to make sure it works. Okay, you tell me real quick. So 311 patients went in, okay, and they maintained, they went for 5 years and they did something called maintenance therapy just to maintain where everything's at, right? So when you go to a dentist, they're doing maintenance therapy, just cleaning your teeth, okay? Same idea. So chiropractic patients spent 31% less, or 31% of the national average for healthcare. So is that better, right? So they're spending 31% of what it would be for the national average, okay? They visited the medical provider 50% less. Right? So they went to the doctor less. Well, how could that be? Just getting adjusted, right? So if someone came into the office like this, what's happening to this nerve? There's pressure on it that goes to, let's say, my heart, right? And then I go in because, man, I have high blood pressure, right? And they're going to give me what? A medication, okay? Going over to this one, 60.2% fewer hospital admissions, 59% less days hospitalized. This one's an interesting one. 62% less outpatient surgeries, and 85% less pharmaceutical costs, less drug consumption, okay? So the thing is there's a right way and a wrong way of doing things. When I look at this up here, I want to end on this. Anytime we do a talk, we actually open it up to the community, right? And so what we do is, in order to figure out if there's a problem, right, if this is going on, what would this be called? What is this? Showing the spine. What is that? What takes a picture of the spine? X-ray, okay? This is showing how tight your muscles are, right? So this person over here is bad, this person's good. And this person over here, white is normal. Any color bars on here are abnormal. Okay, so they have pressure on the nerves in here. So we do an evaluation in our office. That's the first thing that we do. When you look at this in here, our evaluation in our office, here's how we figure out if there's a problem. If I looked at someone's posture, does that make sense? I can figure out if there's something going on with the nerves, right? So if someone came in that looked like this, I could say, hey, there's a problem going on here, okay? Bilateral weight scales. If someone put 20 pounds more pressure on one side than the other side, would that be an indicator? Okay, so a good example of this is if anyone's ever had knee surgery, right? What do they want to do? They want to avoid that knee. You know what happens? They toss in school, it goes knee, knee, hip, hip. Or it goes knee, hip, hip, knee. They'll get replaced, okay? Because what do? They put more weight on the other side, misaligns this knee, and guess what happens to that cartilage? It wears out, okay? Range of motion. If someone can only turn their body like this, or they do one of these to look, okay, does that tell me there's a problem, right? Thermography is a nerve test. It just tells if there's pressure on the nerves. EMG test is muscle test, and then the x-ray, okay? If you went to a medical doctor, how much would that cost? If you had all those tests done, throw out a number. Thousands? You guys say thousands is fair, x-rays and everything, okay? So $1,000 to get all that stuff done, okay? What we do is anytime we do a talk, we open it up to you guys and we open it up to your family, immediate family, okay? We actually waive that cost. So if you guys want an evaluation in our office to figure out where you guys are at, we actually do that. We make it really simple. We've done this so many times, we know how to make it effective, okay? You guys all see the sheet on here, okay? On here, all you would do is circle the day and time you would want to come in, okay? The only thing I'm going to say about this is because we book out the appointments on here, we actually request you guys fill it out today so we can actually schedule an appointment so we know who's coming in, okay? You guys can make this for anyone that lives in your household, so if it's a spouse or a kid to get checked, you guys saw that video about kids, okay? But we will waive the cost of the entire evaluation for you guys, okay? So all you would have to do is fill this out and give it to Christy, and she'll put it on the schedule, okay? Christy, am I forgetting anything?
Vitamin D.
Oh, yeah, okay.
Question.
Here's what we're going to do. If you guys want to come into your evaluation, I will say this. If it's a two-part appointment, it's the evaluation, and it's also the review of findings, okay? A lot of people also ask about insurance, okay? We call insurance before we ever do anything, and we figure out if they're going to cover it or not, okay? But the first two appointments are covered. Does that make sense, okay? What I'm going to do is I'm going to open it up to questions about anything that we talked about today. Okay? If you guys have any questions, I am going to answer them, okay, while you guys are filling those things out, and you guys can give them to Christy. So is there any questions? Any questions? All right, so here's what we're going to do. We're going to give out the vitamin D. Okay, everyone stand up real quick. Here's how this is going to work. When you guys were in grade school or middle school, there was a game where you sat on the desk, right? And you would have to pass around the ball, and then you would have to answer the question. If you got the question wrong, you'd have to sit down. Does that make sense? Okay, so here's what we're going to do. I'm going to start here. You can throw it to anybody afterwards, but I'm going to ask you the question. If you get it wrong, you sit down and you still throw it, okay? All right, what two things make up the central nervous system?
Your brain and your spinal cord.
Perfect, throw it. So you're still in. All right, what makes up the peripheral nervous system?
That is your brain, or your nerves.
Perfect, throw it. Okay. What's the cartilage called in between the bones in the spine? What's the cartilage called in between the bones in the spine?
Oh
Any idea?
my. Disc.
There, you got it. Okay. Who said it? Who said it? Okay, all right. Throw it to whoever, and then you sit down.
I don't have to.
Yeah, I'm done.
I have to say that.
All right. How many bones or how many vertebrae? Hear that question.
24.
Perfect. Throw it. How many bones make up the spine?
26.
Got it. Okay. There's 24 vertebrae. What are the other two bones that make up the spine?
That's
Okay. Anyone know? Anyone know? The other two bones?
it.
Got it.
What was it? The
Sacrum and coccyx.
Oh.
Okay.